We've had so many messages to do a video on eye twitches, and I guess the time has come. In this week's video, we're going to be looking at why it happens, tips, treatments, and most importantly, we're going to look at when you should seek medical attention for the eye twitches. So first of all, is an eye twitch something that you should be worried about? Well, generally speaking, eye twitches are very common and they're very rarely anything serious. Usually, they go away all by themselves. Now let's say you've had an eye twitch for more than 2 weeks. Well, that's when you should seek medical advice about it. Now there's loads more reasons when you should seek medical attention about an eye twitch, and I'm going to discuss that later on in the video, and everything that we speak about in the video will also be available in the description below, so feel free to check it out at any point in the video. So moving on, what are the symptoms of a twitching eye? Because we're all different and we can all experience different symptoms. Now generally speaking, an eye or an eyelid twitch, whichever you want to call it really, has a sensation of flickering, quivering, or a gentle tug in the eyelid. It can be repetitive, occurring every few seconds or every couple of minutes. So we now know the basics, but how do we stop an eye twitch? Let's say you've had one for a few hours or a few days and you just want to get rid of it. Well, there are a few things that you can do to help, and we're going to run through them now, but please do let us know in the comments below which one helps you the most, and we can maybe do our own little YouTube experiment from these results to see which one helps the most. Now let's begin. So tip number 1, I was actually informed this by a GP colleague of mine in practice, and that's to apply a warm compress directly to the twitching eye, and this is going to help relax those muscles. And to be quite honest with you, I've had some really good feedback from patients that I've recommended this to. Now if you're wondering how to do a hot compress, it's really simple. All you have to do is get a clean washcloth or a flannel, soak it in hot water, wring it out, obviously make sure it's not too hot that you burn yourself, wring it out and then apply it to the eye, and then once the heat starts to go from it, you can do that process again as many times as you want really. Now in terms of how long and how often you should be doing this, because I'm pretty sure a lot of people will be wondering this question, I'd say as soon as the eye twitch is gone, that's it, you don't need to continue doing it. Once you have the eye twitch, I'd say do it a couple of times a day, but most importantly, do it when it's convenient for you. That's the most important thing. Tip number 2. This can be done either after the warm compress or even throughout the day, and it's just gently massaging the area of the eye twitch, and this is going to help a lot. But please remember, please wash your hands first before you do it and be gentle. The most important thing is that you keep your hands washed and clean, because the last thing you want is an eye infection whilst you've got an eye twitch, I guess. Tip number 3, if you're someone who uses a computer quite regularly or watches a lot of television or uses a phone quite often, you need to start taking regular breaks, because what all of these screens do is they cause something called digital eye strain, and that is not going to help with an eye twitch. So if you are someone who has a lot of screen time, please every 30 to 40 minutes take a 5 to 10 minute break, and that's going to help reduce that digital eye strain. Now during those breaks, get up and go for a walk. That's probably the best thing that you can do. Try and stay active, because sitting down for long periods, well, that's not good for you either. Okay, tip number 4, monitor your alcohol and caffeine intake, because too much of it can actually cause eye twitches. And I know it's easier said than done, but the first thing you should begin with is keeping a log of it on your phone or on a piece of paper, and write down how much coffee you're having, how much tea, how much energy drinks, how many alcoholic beverages. So basically, how many times you're having caffeine and alcohol. Log all of that on your phone or on a piece of paper. Now once you have the data, you can then analyze it to see if you're having a low, medium or high amount of caffeine or alcohol. Now what I'm going to do is I'm going to leave 2 calculators in the description below, one for alcohol and one for caffeine, and I'd highly recommend you use it to see how often and how much caffeine and alcohol intake you're having per day. Now, just a heads up, the caffeine intake calculator is actually a calculator used for pregnant ladies, but the actual calculating software on there is really good. So just giving you a heads up before you go on there. Moving on to tip number 5, get plenty of sleep. So if you're an adult, you need to aim for about 8 to 9 hours every single night. Also, try to stress less and relax more. All of these are going to massively help with eye twitches. Now recently, I began doing yoga, and I started watching YouTube videos, and there's loads of different yoga tutorials on there. And to be honest, I feel great after it. I feel so relaxed and less stressed. But then again, I guess it's not everyone's cup of tea. As we say in the UK, it might not be your cup of tea. And if it's not not your cup of tea, I'm gonna stop saying cup of tea now, then there's loads of other different things that you can do to help you stress less and relax more. The NHS have some really useful articles all about this topic, so what I will do is I'll leave a link to it in the description below, so if you're interested, please check it out. In some cases, having dry eyes can lead to eye twitching. Now you must be wondering, well, how do I know if I've got dry eyes? Well, some of the symptoms that could suggest dry eyes include itchy eyes, sore eyes, gritty eyes, and also your eyes being more watery than normal. But these symptoms are seen in a range of other eye conditions as well, so the best advice I can give you is always speak to your healthcare professional if you have any of these sort of dry eye symptoms. They can assess your symptoms, examine you, and find out exactly what kind of eye condition you've got, and if you do have dry eyes, they may recommend an eye drop for you to use. And tip number 6, medication. Believe it or not, some medicines can actually cause eye twitches. So, if you're taking a medicine and you feel like the twitches have increased or it's causing you eye twitches, then speak to your pharmacist or your doctor about it so they can advise you appropriately. What I wouldn't recommend is that you stop that medication without getting the advice first. So just speak to your healthcare professional and get some advice. So that's the end of the tips, but as I said at the start of the video, there are certain situations where you will need to seek medical advice from your healthcare professional. So what I'm going to do is I'm just going to list through them. So for example, if you've had an eye twitch for more than 2 weeks, if you have a twitch in more than one place, if the affected area feels weak, and if you're taking any prescribed medication which you think is causing the eye twitch. Now I'm going to leave loads more information in the description below for you, so please feel free to check it out. I really hope this video helps you, and please do let us know which one of the tips has helped you the most. Maybe we can do our own little YouTube experiment, so don't forget to leave a comment below. Thanks for watching, always remember you're awesome, and I will see you next week. All by themselves. Take a break, take a 5 to 10 minute bake. Oh my god, it's so hot in here. It is literally, like, I'm on fire right now. I'm actually on fire. I mean, I'm not going to show you the other side of this, but it's sweaty, trust me. How's the hair? Yeah? Jesus Christ. I need to finish these because I am absolutely roasting in here. I really, really want to get out of this room. I'm gonna do 2 scenes in this room and I'm gonna get out, but I might not make it because I might die of dehydration. Boiling, mate. Absolute boiling. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.